You know, it's funny, when I see patients in the office, historically, one of their biggest concerns was always anesthesia. And the promise I make to my patients is, I will never let an anesthesiologist put you to sleep if I wouldn't let them put me to sleep. I feel the same way about the OR environment right now. I wouldn't be going into work there every day if I didn't think it was safe. And if I feel that it's safe for me, then I know that it's safe for them.
And of course, everybody was wearing masks, including myself. And then I was escorted by someone who kept a distance from me and escorted me to, in this case, to have my procedure.
And it's been quite the journey. COVID basically hit us like a storm.
And I know that COVID is new to the world, but we have taken it in great stride.
We wanted to make sure we were following all the CDC recommendations, as well as what the county had really encouraged us to do.
In my 30 years here, I've always been impressed. From when I first arrived at Torrance Memorial, there's always been an incredible culture of safety.
We have a really helpful checklist guidelines on the website.
Here's what we are doing to keep our patients safe. First of all, we're isolating our COVID patients. We have implemented strict isolation practices to separate COVID-19 patients from other patients in our care. We are also providing mandatory daily screening and temperature checks. Every person who enters our facility goes through a daily screening and temperature check. We also have proper personal protective equipment, or PPE as you have all heard about, to ensure the safety of our patients and of our staff. We have an ample supply of all the necessary PPE required for any medical or surgical treatment. Extensive training. Our physicians, nurses, and all of our ancillary care team members have clinical training and expertise in infectious disease prevention and follow strict protocols for maintaining a safe patient environment. We also have instituted infection prevention distancing. We have implemented many physical distancing measures throughout the hospital and at our physician offices. Cleaning and maintenance. Torrance Memorial Medical Center follows CDC protocols for cleaning and disinfecting all patient and treatment areas. Rooms are thoroughly cleaned and disinfected between patients. A no visitor policy. In accordance with the CDC guidelines to protect our patients and staff, no visitors will be allowed in any inpatient areas until further notice.
Our no visitor policy, which is a concern for a lot of patients, but it's the right thing to do for you as a patient, and then also too for my staff, which is a part of my job to make sure everybody is safe.
Not having visitors on campus, and that has certainly been really tough on our patients, tough on the staff. We've been creative. We have provided patients the opportunity to Zoom with their families, FaceTime with their families, and we do make some exceptions, and those exceptions are really thoughtful with a screening process so that we can make sure people can be connected at the times that really matter the most.
I think they're doing everything possible for the safety of the staff as well as the patients.
Our nurses are absolutely incredible. They are so focused on patient care and safety, and that's always been the case, now more than ever. But the precautions that the hospital has in place for the patients are followed very carefully.
I love being a nurse. I started into nursing because I wanted to help people. But what I think has been so rewarding is to witness the art of nursing, which has been really marrying the expertise and the skills along with just tremendous compassion and bravery. And you really see that art come together, and it moves you.
I think that in life, everybody has times that they look back to that were trying times in their life, or there may have been trying times in our culture. Everyone pulling together in this time where it would be very easy to retreat and act selfishly. Instead, what we're seeing is everybody bringing out the best in themselves.
I love being a nurse. This is when you actually look back in your career and say, wow, I was actually part of a great, great team.
It feels like a family. It really does. And so, you know, in the times like this, families cling to each other, families get closer. So I can't see how it will not make that family, the Torrance Memorial family, and the community family, even closer than it ever has been before.